afternoon. Since we last reported, there has been no additional cases of COVID-19, which leaves our total to 1,526 persons. There are 645 COVID-19 cases under investigation. 615 cases are active. 905 persons have recovered. And now there are 8 deaths, as the CMO just reported, 2 additional deaths. The demographics remain relatively unchanged. The majority of the cases are in the 25 to 44-year age group. The majority of the cases are in the Kingston, Calico, and Pembroke health districts. Most of the cases are women, 55.8%, compared to men, 41.8%. The COVID-19 cases by date and from December 13th up to the 24th. This graph was last presented on the 15th of February. So notice since then that the cases which were recorded continue to be minuscule. When you look at the section in the middle of the graph, you will see that the downward trend continues. The positive rapid antigen test, this continues to trend downwards. Of course, there will be days when more cases will be recorded when compared to others, but the graph generally trend is downwards. The positivity rate, despite the uptick on the 21st, this rate is trending downwards. Notice that from February 14 to the 20th, the positivity rate was below 5%. And on the 23rd, the rate was again below the 5% threshold. We're going to be looking at the vaccine uptake. 1,330 doses of vaccines have been administered. 1,325 persons have received their first dose and 5 persons their second. This includes 1,305 doses of the brand AstraZeneca and 25 doses of Sputnik V. Of those vaccinated, 150 are healthcare workers, which is 11.3% of the total number of persons vaccinated. Healthcare workers include doctors, nurses, laboratory technicians, and attendants, just to name a few. When we consider the health districts, 381 vaccines were administered in the Calico Health District. This is 28.65% of the total. 302 in the Kingston Health District, 22.71%. 206 were administered in the Northern Grenadines District, which is 15.49%, followed by the Marico Health District with 178 vaccines, which is 13.38%. In terms of the number of persons vaccinated in relation to the health districts, there were 491 persons in the Calico Health District, which account for 37.06%. Kingston Health District, 19.09%, which is 253 persons. Northern Grenadines, 206 persons, which accounted for 15.55%. And then the Marico Health District, 122 persons, which is 8.75%. 649 males were vaccinated and 662 females. Most of the persons vaccinated are in the 55 to 64-year age group. This age group accounted for 21.78% of those vaccinated, followed by the 65 to 74-year age group, 19.50%, and then the 45 to 54-year age group with 14.86%. Note that we also have persons in the 18 to 24-year age group and the 25 to 34-year age group coming forward to be vaccinated. These two age groups accounted for 4.72% and 10.77% respectively of the persons vaccinated. Thank you very much.
Thank you very much, Mrs. Cottle, and also thank you to the CMO. We'd also like to let you know that at the end of the first conference, we'll be joining 3 members of the Rotary Club who will today be handing over some 14,000 masks to the Ministry of Health, Wellness and the Environment. So that's right after our questions and answering segment at the end of the press conference. We now call on the Senior Nursing Officer, Community Nursing Service, Ms. Julie Russell, to do her presentation on the COVID-19 vaccination process. Can you unmute your mic, please, sister?
Sorry, thank you.
Fine.
I must first say that I am not wearing a mask because I am in a room all by myself. The Honorable Sinclair Jimmy Prince, Minister of Health, Permanent Secretary, Mr. Cuthbert Knights, Chief Medical Officer, Dr. Simon Kieser Beach, Medical Officer of Health, Dr. Roger Duncan, the media, colleagues, good afternoon. Now, months and weeks ago, our conversation to this pandemic was testing for COVID-19. Now the conversation has changed slightly to vaccine, getting the COVID-19 vaccine. The ministry is happy when our people show interest in their own health. So when persons ask for the vaccine, persons ask to be tested for COVID-19, we love that. Presently, the ministry is offering the AstraZeneca vaccine to this nation through the following health facilities: at Shotty Smart Hospital, the Bookman Polyclinic. Now for Kingston Health District has one health center, and that health center is being used as the flu clinic. So we are administering the vaccine at the Planned Parenthood that is next to the Searchlight for persons living in around Kingston. We give the vaccine at Stubbs Polyclinic, Levi Layton Polyclinic, Modern Medical Diagnostic Center, Sandy Bay Health Center, Port Elizabeth Health Center, Canawan Health Center, Myro Health Center, and Clifton Health Center in Union Island. Now, our target population presently include our health workers, persons who are 65 and older, persons who have diabetes, hypertension, along with their relatives, our security officers and teachers. Now, the process for administering this vaccine is very simple. Persons can make their appointment, go to the vaccine site. So any of the vaccine site, you can go there and you can make an appointment. Also, there is an SV3 health page on Facebook. There is a Google form there that persons can fill out and submit. After filling out and submitting this Google form that you will find on Facebook, on our Facebook page, a staff at one of the vaccine sites will call you to tell you your time, your date, and where you should go and receive this vaccine. What we are doing though is letting the nation, our people, go to a vaccine site that is closest to them. Now, when you decide you want this vaccine and you get to one of the vaccine sites, before administering the vaccine, the healthcare provider will check person's vital signs. We will check your temperature, your pulse, your respiration, your blood pressure. Now, for some persons, we know that as soon as they notice that nurse have this blood pressure machine, they can then develop a fright that will send the pressure up. Or it might be a hypertensive sitting in front of us whose blood pressure is not controlled. So after doing the reading, we realize that it is a high reading. As normal, like going to see the doctor or going to get your blood pressure checked, we will leave you to relax a while, try and reassure you and all of that. And we check the blood pressure. Now, if after we checking the blood pressure, the reading is a reading higher than 180 over 110, we don't give that vaccine. We refer you to a doctor. Now, if it is lower than that, we give the vaccine. We also ask if you have any allergic reaction to anything, whether medication, food, or whatsoever. And we also reassure persons. Now, persons will come to us because they want to get this COVID-19 vaccine. But when they get to us, they have this fear. They have questions that they still need to be answered, even though they are saying they want the vaccine. So in this case, we are willing, and yes, we reassure these persons. Now, after receiving the vaccine, we allow persons to rest for 20 to 30 minutes so that we can look for any adverse reaction. Like any medication, you can get an adverse reaction. Normally in St. Vincent and the Grenadines, we have a form that if there is an adverse reaction, that we will fill it out, and COVID is no exception. For our shut-in, we are going to take this vaccine to our shut-in. So the loved ones for who may have your elderly at home, your shut-in persons at home, you know the health center that normally take care of your shut-in client, please call the health center if that person show interest in getting the COVID-19 vaccine, and we health team will make the arrangement and go to these persons at home so we can vaccinate our shut-ins who show interest in getting the vaccine. Now, to conclude, wearing a mask and social distancing help reduce your chance of being exposed to the virus or spreading it to others. But these measures are not enough. Vaccine will work with your immune system, so it will be ready to fight the virus if you are exposed to that virus, which is COVID-19 virus. So stopping this pandemic requires using all the tools that we have available. Thank you.
Thank you very much. Thank you, SNO, for your presentation. As we all know, myths and misconceptions abound relative to COVID-19 and the COVID-19 vaccine as well. This afternoon, we'll get a personal perspective from the Chief Laboratory Technologist, Mr. Elliot Samuel, in this respect. Mr. Samuel, over to you.
Protocol having already been established. Health professionals, ladies and gents, members of the media and the public at large, good afternoon. I want to talk to you a bit about what I consider to be myths and misconceptions of what I very often refer to now as a little dose of hope, the COVID-19 vaccine. Now, for the last 15 months, the world have been experiencing an unprecedented pandemic and have also seen an unprecedented collaborative response to combat this pandemic. Now, to date, we have 4 vaccines that have been given emergency approval for use. We have the Pfizer-BioNTech, Moderna, Sputnik 5, AstraZeneca, also marketed under the Covishield brand. And we are awaiting approval for 2 other vaccine products, Johnson & Johnson and the Novavax. While vaccines have brought much hope as we lead the fight against this pandemic, it has also evoked much widespread skepticism among some people, myself not being an exception, leaving them, and I may say us, with a troubling dilemma of whether to take or not to take the vaccine. Now, I am not about to ostracize and or mock anyone with vaccine hesitance, anyone who is hesitating to take the COVID-19 vaccine. I think it's reasonable for persons to want more evidence than they might usually require for other vaccines, considering the short period of time under which these vaccines were developed. So my goal in today's presentation is to arm you with enough information so you can educate yourself, your family, your friends, your neighbors, and the wider community to combat this barrel of fear, of misunderstanding things, so you can make an informed decision with regards to the COVID-19 vaccine. Now, the question that is plaguing most people right now is the question of should I take or not take this COVID-19 vaccine? And I myself struggle with that dilemma for a bit. Now, this personal dilemma is fueled by several questions persons are asking themselves. Why vaccines? Are these vaccines safe? What are the side effects? Are they tolerated well by the human body? Will the vaccines protect me from this COVID-19 disease? Is there a microchip in this vaccine? And in a conversation I had just about 2 days ago, there was another question, quite interesting. Is it true that the vaccine contains a programmable nano operating system? Before we dive into these questions, let's look at what we have available now to fight this COVID-19 pandemic. And this is what I sat and thought about, just to be a bit more pragmatic. Now, according to the latest guidance from PAHO, WHO, CDC, the recommendations are social distancing, avoid large gatherings, wear a mask, sanitizing, and to adopt virtual meetings, just like we're doing now, and our events. Now, what transpires if we get exposed, we get tested, we go into quarantine, we wait on a test result. If the test is positive, we go into isolation for up to 14 days. In some instances, it could be longer, until we have symptoms resolution and a negative PCR test, where we can no longer pass this virus on to someone else, then we are released back into the community. Now, these things work. I must admit that they work. However, they are difficult to sustain, and not everybody can perfectly implement them, not to mention the impact that they have on our community. And we're all living it, so we know the impact that COVID-19 is having on the community. So this leads me to what I consider to be the next best alternative. And this was my rationale, really. An alternative that I love to refer to as a little dose of hope. Now, this is a phrase I stole from something I saw on YouTube. One of my colleagues in the other island sent me a link to a video. It was about a program aired on a Trinidad station called A Little Dose of Hope, where Dr. Stewart was talking about the COVID-19 vaccine. So let's move to question number one. Why vaccines? Vaccines are an amazing biomedical tool that we have at our disposal. Actually, I think it was 1999, at the turn of the century, where the CDC declared that vaccines are the greatest public health advancement of the 20th century. Now, what vaccine does, in a way, they train your immune system to recognize and fight a germ, just like COVID-19 is a germ. Because there are those persons who will say that your natural immune system will fight this germ. And yes, it will. You have the antibodies in your systems, your B cells and your T cells, but vaccines train your immune system to recognize this germ early. So your system is not caught lying and waiting and allowing that germ to multiply in your system to a level where you can actually now have a disease condition. So if you look at the chronology of vaccines, because of vaccine, the world was able to eliminate or eradicate diseases like polio, smallpox, disease that decimated and disfigured many people. Now, we owe these discoveries to people like Edward Jenner, who in 1976 performed the first set of inoculation using pus from a cowpox blister. He actually noticed that persons who were working with the animals, they were immune to smallpox. And they later discovered that if they use the pus from these smallpox blisters and inoculated healthy persons, that those persons became immune to smallpox disease. Whooping cough vaccine, which is really the first vaccines created after smallpox, caused by a bacteria that we call pertussis, was developed 140 years later. Now, whooping cough was a terrible disease. Young children often became the recipients of death to this disease. And had it not been for vaccination, a lot of suffering would have been prolonged. 12 years later, we saw the development of diphtheria vaccine. 12 years later, we again saw the development of tetanus vaccines. Now, this brings us to the question number two. Is the vaccine safe? So we know that vaccine helps tremendously, but there are still a lot of questions of is the vaccine safe? And one of the concerns has to do with the timeline. When compared to the timelines I just described, the COVID-19 vaccine was produced rather speedily. And this speed has fueled a lot of skepticism. Now, we understand your concern. However, that development didn't really take place in just 10 months. It didn't just take them 10 months to create these vaccines. Work began on coronaviruses actually as far back as 2003, when the world experienced the SARS outbreak. And it continued when there was the MERS outbreak a few years later. By the time we began experiencing SARS-CoV-2 outbreak in December of 2019, there was a wealth of research data to build on. Couple that with the fact that there was global collaboration and a wealth of funds was then thrown into research and development, it really isn't surprising that we got a vaccine in such a short space of time. Now, the technology that they're using now for vaccine is a lot different than what was used years ago. And this has a lot to do with science. Science is very dynamic. As a matter of fact, the only constant about science is change. You will see that something that is good 10 years ago may not be recommended today. So we expect science to move at the speed of change. Before, we were using live attenuated viruses, in some cases dead viruses. The technology that is being used today by Pfizer, Moderna, Sputnik, and AstraZeneca is a technology where they're using messenger RNA. And they're no longer giving us an entire virus. Even if it's not a live virus. They're no longer giving us the entire virus. We're actually being given a piece of the viral messenger RNA. Our cells will take up this messenger RNA, decode it, and make a piece of the virus. Just a small piece of the virus. Actually, the part that is made is the spike protein, the part that attaches itself to the cells to get into the cells so that that virus can make more of itself. Our body then recognizes this product as foreign and builds an antibody to it. And it also stores the information in our B cells for future reference. Now, the mRNA fragments that we take in the vaccine, they're very fragile. They're going to disintegrate and disappear from your body very, very quickly. So it therefore means that you can build the immune response that you want without having the effect or having the side effects that was there on the previous methods. Let me attempt to elaborate a bit on question 4 and 5. Are vaccines tolerated by the human body? And will the vaccine protect the individual from disease? Now, most people who get vaccinated will experience a mild side effect within 24 hours. And I've had my vaccine, and I can attest to this, that you are going to feel some discomfort within the first 24 hours of receiving the vaccine. Now, the discomfort is going to vary. There's pain around the injection site, swelling around the injection site. There's a general feeling of tiredness. The headache comes on. You have fever, chills, body pains. In terms of my personal experience, it was about 12 hours after I took the vaccine. I started with the fever first, and that progressed into chills, what we call ague. By the morning, I had the headaches and the generalized body pain, but by 24 hours after vaccination, it all disappeared and I was back to a state of normalcy. I couldn't go to work the day after I took the vaccine because I wasn't really up to it. Physically, I wasn't up to it, but I was back to work the day after. I think most persons are really on the issue of adverse reaction. And one of the concerns I get from a lot of friends is that they don't know how the vaccine is going to affect persons months or probably years down the road. No, we have to be guided by the science. And this is one of the things that we tend not to do a lot as a people. We need to look at the data and we need to be guided by the data. So if you look at the history of vaccines, if you look at the data on vaccine reactions, the data shows that a vast majority, if nearly all of them, occur in terms of adverse reactions. They occur in the days post-vaccination. As a matter of fact, I think it's about 4 to 5 weeks after. Within that time period that you're going to see most of your adverse reactions. Now, globally, there is safety data beyond that amount of time. At a minimum, I think we're about 10 to 12 weeks in terms of safety data on a global level. Millions of persons have been vaccinated globally. And I think it's probably about less than 12 persons to date that have shown any adverse reaction to the vaccines. So on the next question, will vaccine protect us from disease? Protection occurs really, I think, about 1 to 2 weeks after vaccination. Now, all vaccines have a common goal to give your immune system a heads up, to prepare that immune system should it ever encounter the real virus. Now, what the vaccine will do is to reduce the likelihood of a person to become sick from COVID-19. And this is what I want the public to understand. A vaccine is not a barrier method. Your face mask is a barrier method. Hand sanitization is a barrier method. Those are designed to prevent entry of the virus. If you're vaccinated and you're not wearing your mask and you're not sanitizing properly, then you increase your chance of contracting the virus. The vaccine will reduce the likelihood of you becoming sick based on the efficacy of the vaccine. And the efficaciousness of the vaccine speaks about the likelihood of you becoming sick. So when we say it's 90% efficacious, you have a 90% chance if you encounter that virus that you will not get sick. There is still a 10% chance that you will. What the vaccine trials did not include is the likelihood of you to pass this virus on to someone else. As a matter of fact, the clinical trials did not seek to answer that question on transmission. And that is something that we are going to have to learn from the real world experience. Now, the question that I get a lot is, what is in the vaccine? Does it contain microchips, programmable operating system? Now, the information on what is in the vaccine is available online. But for the persons who don't have the time to look, you don't want to look, I can say to you now that you have that fragment of messenger RNA. And that fragment of messenger RNA is encapsulated in a lipid layer. Call it what you want. Cholesterol, it's really just a lipid. It's a fat layer that helps that mRNA to enter the cell. It has to get into the cell, not into the nucleus, into the cell, into the cytoplasm where the ribosomes are located. The ribosomes are what is going to decode that messenger RNA. There is also sugar and salt, some dibasic salts, that stabilizes the mixture and the molecule. There is nothing else that is inside of the vaccine. There is no microchip. There is no programmable operating system. I think the fear for the microchip came from an agreement signed between a company called Apijec and the Trump administration. And you can do your research. I did my research as well. The company actually developed a plastic self-injectable vial to hold the vaccine. So they are the makers of a receptacle to deliver the vaccine. They do not make vaccine. Now, what the company has offered is an option to have some of the vials outfitted with an RFID chip that is located under the label. Now, as explained by the company, the RFID chip on that piece of, or that device, is there to track the deployment and use of the vaccine for public health purpose, as well as monitoring the expiration date on the product. Now, the whole idea of RFID tracking being part of the vaccine was just taken by the anti-vaxxers out of context, and they had a massive field with it. Now, in closing, I trust that you, the vaccine hesitant person, just like I was, that you're going to look for the information yourself and get your information from a trusted source, educate yourself so you can make a good decision. You can educate your family to make a good decision, your friends, your neighbors, your community, and you can help us to combat this barrel of fear, of misunderstanding things, so we can all do the right thing. I think from the data that was presented previously, you can see that our vaccination levels is only at 1.2% nationally, and our goal is to get it to 70 to 75% so we can benefit from the concept of herd immunity. We can bring our community back to a state of normalcy. I know everybody wants to get back to normal. All of my friends are asking, when are we opening up? I'm asking them, when are you taking the vaccine? They go hand in hand. Us going back to normalcy and you taking the vaccine, there are parallels. So in closing, I encourage everyone who is between the age of 18 and I think 65, don't hold me to that, I'm not sure what the upper limit is, but you can call the public health team to find out what the requirements and the age limits are for the vaccines. And if you are within the age range, please make the right decision to get vaccinated. It's only there to protect you, protect your family, and to protect the wider community against this pandemic. Thank you.
Much, Mr. Elliot Samuel, who is the Chief Laboratory Technologist, for that very personal account. Now we have heard from all of the presenters. Ladies and gentlemen of the press, the microphone is now open for your questions. Any questions?
Hi, good afternoon.
Good afternoon, Bria.
Yes, I have two questions. I just wanted to know, how long after someone has recovered from COVID-19 do they have to wait before they can be vaccinated? And just an update as to whether any of the COVID-19 variants have been detected in St. Vincent and the Grenadines.
Okay, so CMO. Okay, so CNO, number one. SNO. The first question.
The first question, how long you can wait to get the COVID vaccine after being positive with COVID-19? Once you are negative from the positive COVID-19 test, you can get the vaccine.
Okay. Question number two, Mr. Samuel.
Okay, so on the issue of whether or not we have detected any variants in St. Vincent and Grenadines, to date, the answer is still no. We are sending our samples to the Caribbean Epidemiology Center in Trinidad. We are allowed a quota of samples per week for checking, as well as we have also instituted a test locally that we can presumptively identify any variant strains, and we have not been seeing any variant strains thus far, neither from our local testing nor what we're getting back from the from CAFA.
Thank you very much for your response. Are there any more questions? Okay, is that it for questioning on this session? I guess that means that our presenters did an excellent job facilitating this afternoon. So I take it that there are no other questions, which means that we can go now to the presentation with the Rotary Club, who will be donating 14,000 masks to the ministry this afternoon. To do that presentation, we have Annette Mark, who is the president of the Rotary Club. We also have Brian Glasgow, who is the treasurer, and Dr. Francois Truchot, who is the assistant district governor and the community service chairperson. So over to you, Rotary team.
Thank you.
Annette and team.
Thank you. Can you hear me properly?
Yes, we are loud and clear.
All right, good. So we recognize the CMO who is on, Mr. Monkeys Beach, and all the senior medical officers who are also on this call, and the media and the public at large. We at Rotary are very happy to be working along with the Ministry of Health to donate these masks, which is at this point in time 14,000, but in total we will be donating 20,000. We are a community-based organization, and we work with public and private, both public and private partners in assisting the community. We are very aware, and we also know that we need to do our part to fight this pandemic, making the public aware of how to wear masks, and that they need to wear their masks, and also that they need to be vaccinated. And today we are very happy to be able to hand these masks over to the Ministry of Health that are to go out to persons that are vulnerable, persons who are a little bit more unfortunate than we are, because we do take it for granted that persons can afford to buy masks. And while the Ministry of Health carry out their awareness campaign, we do hope that these masks will go a very long way in assisting this fight against the COVID pandemic. Thank you.
Thank you very much. And we'd like to ask the PS, or Permanent Secretary, to respond.
Pleasant good afternoon to all, and it is indeed a pleasure of mine to be able to be on the receiving side of such a generous donation. We are quite aware that St. Vincent and the Grenadines are progressing very nicely in terms of our COVID-19 response. And mask or face covering, because there's also face shields, is one of the very important elements in the fight against COVID-19. We are always so grateful. This is not the first time that the Rotary Club has actually donated to the Ministry of Health. We have had strong bonds of solidarity and friendship, and Dr. Chusha and his team have came to our rescue on several occasions, within the form of wheelchairs and others. But this gift of mask, I think, is a very special one, given the current situation that is facing us. Mask is something which are used up at a very rapid pace. And because they're used up so rapidly, it means that we have to be able to have them replaced. I want to express my sincerest thanks to you, the Rotary, Dr. Chusha and his team. And we really do look forward to our continued collaboration in this stead. And we can assure you that the mask will be put to the maximum use. And we look forward also to your further generous donation. We want to thank you very much, and we're most grateful. On behalf of the Minister of Health and the Ministry of Health, we thank you.
Thank you.
Thank you very much, Madam President and team. We look forward to working with you, and we'll see you soon. Thank you.
Definitely. Thank you.
Okay, great.
Thank you.
Well, that brings us to the end of today's press briefing. Of course, we heard from the CMO, who announced that there were 2 new COVID deaths to report on. We also got the presentation of the latest statistics from Maxine Glasgow-Cottle, the statistical officer, and Senior Nursing Officer Julie Russell outlined the vaccination process. And rounding up the presentation lineup this afternoon, Mr. Elliot Samuel, Chief Laboratory Technologist, who gave a personal perspective surrounding the myths and misconceptions of the COVID-19 vaccine. That's it for today. We'll see you again next week. Thank you for joining us.
My name is Luke King. I'm from Beckway in Port Elizabeth, born and raised. I saw it on the television and a lot of people taking it in different countries. But I know sooner or later, we'd have to do the same. And eventually the protocol will be that is a compulsory for the travelers all over the world. So you will not be able to get from America to St. Vincent, from St. Vincent to Canada, or anywhere in the world, for sure. So that's the reason why I got motivated. I want to be up and ahead of the system because I want to make sure if there's any other things that's supposed to happen to me and whoever there around me, I already got the vaccine and I feel a little bit protected. Because before I was actually panicking and figured that the whole world was going down with this virus. So when I heard the vaccine coming on stream, I was excited. So I did my best to get vaccinated, and so it happened to me this day. The only feeling I have right now is a little choke I get, but that's it. Nothing else different. I feel like a normal human being like every day I used to feel. I talked to a lot of friends and they decided not to do it, but now I did it now. I know a lot of those friends are going to get motivated and come and do the same. Because a lot of them tell me that I must go ahead and do it, and then they will follow me. If I get and I perform properly, they will do the same. So I urge all the people out there who are afraid of the vaccine. There's a regular vaccine, like when you was going to school for the first time at the age of 5, you get the same vaccine, feel the same way. Just mean it's better for your health. It's not as bad as you was told, but to be honestly, I've been through it right now and I did it and it don't feel much different to me. Besides, it's good for your health and I believe in it.